October 12th. I have Thursday, Friday, and weekend off. I think she has just.
Hi, so sorry, I've been having technical problems. I actually did not realize that my video was on pause when I gave the presentation. So what I'm going to do is I'm going to represent, and I had emailed the student that was participating in the discussion. I had emailed her the evaluation sheet and the questions. I'll just have her fill it out and then send it back, just so you have documentation that I actually did the presentation to other students, and it's not just a video of me talking. So anyway, so my talk is about how home health nursing can reduce the risk of rehospitalization of patients, CHF patients, and how we use teaching and medication reconciliation to help them take control of their health and prevent them from going back into the hospital. So some statistics: about 6.2 million adults in the United States have heart failure. In 2018, heart failure was mentioned on 379,800 death certificates. Heart failure cost the nation an estimated $30.7 billion in 2002. Heart disease is a leading cause of death for people of most racial and ethnic groups in the United States, including African American, American Indian, Alaska Native, Hispanic, and white men. Now, for women from the Pacific Islands and Asian American, American Indian, Native Alaskan, and Hispanic women, heart disease is second only to cancer. And I obtained this information from the CDC's website. So there has been a 20% drop in rehospitalizations with patients that have been coached on how to manage their disease. The Washington Post reported that indigent population did benefit from the need of case managing or a visiting nurse to help with the logistics of appointments, to ensure the rent check is paid, and to remind people to take their medications, make sure prescriptions don't go unfilled because of an unpaid copay. So I'm first going to start talking about the pathophysiology of CHF and the modifiable risk factors that we teach patients and how to manage them. So basically, our teaching is involved with encouraging diets, a reduction in sodium. They're recommended to have no more than 500 to 600 milligrams of sodium per meal, or limit their total daily sodium intake of 1,500 to 2,000 milligrams. We also advise our patients to limit saturated fat, avoid trans fats, which raise LDL levels, and lower HDL levels, which is a good cholesterol, and increase fiber and antioxidants. A minimum of 20 grams of fiber is recommended each day. So I usually teach my patients to choose whole grains such as oats, whole wheat, brown rice, whole grain, and barley, and to also maintain a healthy weight. Patients should be checking in with their doctors if they are overweight, to see what their BMI is and to get on some kind of nutritional program to lower their weight. Now, as far as what we do on our visits with CHF patients, we teach them, there's several symptoms we teach them to look out for. We have them look at their legs and ankles and feet, and we have them monitor for any swelling or edema. And we also have them weigh themselves daily. Patients are instructed to weigh themselves the same time every day, and to wearing the same amount of clothes. Usually when they first get out of bed after they've used the bathroom. And they are told to report a weight gain of 2 pounds or more in 24 hours or more than 5 pounds in a 7-day period. They're also taught to balance activity and rest period, to eat plenty of protein, to encourage healing with their incisions. And they're also instructed to report any shortness of breath during rest and any sudden chest pains to call 911. Now, one of the questions I got from my student Angel was, the swelling only happen in the legs? The answer is no. That's where that's the most common area for swelling to present, but I have seen swelling in their, I had a patient that had some swelling in her left forearm. So it's always a good idea to have them hold out their hands and their feet and to look at both limbs at the same time. Now I do want to talk about medication reconciliation. And that comes in 3 parts. The first part is verification, where we need an accurate medication list to base their MedRec off of. Now, for CHF patients, they should be discharged. In their discharge instructions, they should have the full medication list. So that's what I use to compare to make sure that they're taking their medications as prescribed. So in the verification step, I go through all their medications. I ask them I go through each medication one at a time, asking if they know why they're taking it. And any new medications are on, I go over what the side effects are. I have to document. Now, we use electronic charting system to actually document the list of medications so they can be sent to the physician. So I chart the name of the medication, the dosage, the frequency, for example, twice a day, every 12 hours, and how long they're taking the medication for. And then the clarification, well, I kind of went over that. The clarification step is to clarify any questions they have about their drug. And another important thing for them to be made aware of is that they do need to make sure that they know to call their prescriptions to their doctor ahead of time before they run out, so they're not missing any dose, which is considered a medication error if they're not taking the right medication at the right time. And then there's the reconciliation stage. So once all the medications are documented and tabulated, they're actually sent through our electronic charting system to the doctor in what's called a 485 order. That gives the doctor the opportunity to view all the medications the patients are taking, reconcile that with their own list, and they actually have to sign off on that. And then a complete list of the medication is sent to their patients. Now, with medication teaching, it is important that, like I said, any new meds they're on, we need to advise them what the side effects are. For example, if they're given an antibiotic, we do need to go over side effects of that, which is usually intestinal problems, and to make sure that they're eating plenty of probiotics like yogurt, where they can take some over-the-counter probiotics. And then with that being said, we do need to identify any of the high-risk medications. The high-risk medications are, let me bring up my list here, would be any antimicrobials like an antibiotic, any potassium or other electrolyte supplements, insulin, and any other hypoglycemic medication, narcotics, opiates, and sedatives, heparin, and any other anticoagulants, and chemotherapeutic agents. Now, with any kind of surgical incision, it is important for the patients to be aware of any excess bleeding if they are taking any kind of blood thinners or any kind of anticoagulants. They also need to make sure that they splint their chest when they're coughing, and that they know to make sure if they're constipated that they drink lots of fluids and take any prescribed stool softeners so to prevent any kind of rectal bleeding. So that's it as far as my teaching. And then another question that was asked to me was about any labs. So we can draw several labs to test or to ascertain, the progress of their healing. We can run what's called a BMP, which is a basic metabolic panel, which states, which shows all of their electrolytes that they're taking. For example, furosemide is a very common medication for patients with heart failure because it forces the body to excrete any excess fluids. So I do need to make sure that the patient is taking their potassium if it is prescribed with furosemide. And a lot of cases, it's very difficult to swallow. They're big pills and patients don't like to swallow them. So a lot of times I will call the pharmacy to see if the pill can be cut in half to make it easier for them to take. So that is it with my teaching. I did send out a survey and a questionnaire to the participant in my presentation, so I will include that when I submit my assignment.